I want to introduce my 5-piece sets of layered blocks. These were designed so any posture that came into my office, I could actually reverse that posture and apply a force. Notice there's thin ones, thicker, 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 all the way to the big daddy. They all have a purpose because little people come in. 4 or 5 years old, 6 months, a day old. We want to be able to use these blocks, which we're going to show, on each and every patient that come in. We typically have all these blocks hanging on the wall. They're not laying around or on the table. I actually train my patient which block they're going to use to set themselves up in that reverse posture so they can actually facilitate in the correction of their own spine on my table every time they get adjusted. So they're very handy. We're going to be showing these because we haven't had a chance to demonstrate them yet on how we can use these for some of these difficult postures that can come into your practice. We have a patient, Kathy, came in with left thoracic shift as well as left cervical shift. You could see the position by using the block and turning it on its side. We're blocking your ilium, so now the position she's put in is right thoracic shift and right head shift, which is exact mirror image of what she proposed. We also place a block underneath her ankles, so that way we keep her pelvis and her feet along the same plane. Okay? This is called a super stress. When patients come in and they've been subluxated for a long time, I will actually put my rib cage on her rib cage, grab the bottom of my frame, and actually squeeze to really emphasize that shift in the opposite position. Now, if the patient owes you money, this is a good move to do. Just kidding. Now, when we're going to set up, notice with the right head shift, we're typically in that posture, we're going to actually tuck the right shoulder down because when a patient comes in with left head shift, I mentioned to you before that it typically raises the opposite shoulder. So the patient has the right shoulder tucked down. The head is actually pushed down into right head shift. We're going to come in, put curve in her neck, bring it back to take her head over her shoulders to eliminate the anterior weight bearing. Toggle that atlas. Let it fly.